Hello, I am Christopher Michael Reyes Mendoza of UST Faculty of Pharmacy, Doctor of Pharmacy Program, Section 1A. And I am here to talk about the roles of the pharmacist in heart failure in a community setting. Community pharmacists play an important role when it comes to management of heart failure. We provide patient education, medication management, and medication reconciliation. Now, let's dig in deeper on the roles of the pharmacist in the management of heart failure in the community.
Ako po si Ligaya Ito ng Barangay Lulumaan, Manawag, Pangasinan. At ako po ay isang BHW. Ako po ay nakitaan ng aming baryo doktor na humihina ng aking puso. Ngunit bilang isang tao na kailangan kumayat para sa may pagkain sa lamisa, kailangan ko rin po ituloy ang aking trabaho. Kaya ang nagagawa ko na lang po ay uminom ng gamot na iniresita ng doktor. May mga pagkakataon po na hindi po palagi andyan ang doktor ng aming barangay. Kaya kay Sir Mickey na lang po ako humihingi ng payo tungkol sa aking sakit.
Community pharmacists play an important role in the management of heart failure. One of the roles of community pharmacists is to provide educational materials, leaflets or pamphlets on relevant information on common chronic diseases such as heart failure. This gives the patient a short course or brief information about the disease he or she has. Being the most accessible healthcare provider, this is very, very important. Explaining the condition to the patient can greatly help in achieving medication adherence. We can talk about the associated risks if the patient mismanage her condition.
Isa po siyang pharmacist sa aming barangay at hinahawakan niya rin po ang pangangalaga ng aming barangay clinic kapag wala kaming doktor. Binibigyan pa yun niya po ako tungkol sa aking gamot, kung paano at kailan ko iinumin. Ipinapaliwanag niya rin po yung importansya ng pagsunod sa tamang oras ng pag-inom. Malaking bagay po na andyan siya sa barangay kasi siya po ang inaasahan namin kapag wala kaming doktor. At gumagawa din po siya ng paraan para maabisuhan ng mga doktor namin tungkol sa kalagayan namin. Malaking bagay din po na inaayon ni Sir Mickey ang mga gamot namin sa kakayan ng aming bulsa. Inaangkop niya ang mga gamot sa aming budget upang masiguro niya na makuha namin ang mga gamot na kailangan namin. Kinukunan niya rin po ako ng BP at timbang tuwing ako ay nadadalaw sa klinik. Binibigyang payo niya rin po ako sa mga ehersisyo pwede kong gawin at mga pagkain na pwede kong kainin para mas maging malusog ako.
As I've mentioned earlier, community pharmacists are the most accessible healthcare provider. Blood pressure monitoring can greatly help the patient monitor the progress of his or her disease or condition. Most community pharmacists provide this service for free, so use it well. We are trained since college to take blood pressure, so this is a very important skill when you are handling patients in a community setting. Monitoring the signs and symptoms of our patients is very important, particularly taking the blood pressure and monitoring the weight. This is to ensure that the patient's medication is effective. Upon taking the blood pressure, it is also very important to write it down in order for us to keep record or to keep track the progress of the patient. We can also see there if the patient is responding well on the medication his or her taking. Monitoring the weight of the patient is also very essential in order for us to know if there are fluid buildups in the body of the patient. Pharmacists can also be a great medium to provide non-pharmacologic interventions such as smoking cessation, lifestyle modifications such as reducing the salt intake, exercising regularly, and monitoring the diet. Pharmacists can also help in the management of medications, especially this is very important when it comes to medication adherence, which is the core of our profession. We have to strictly promote adherence in order for us to achieve the maximum optimize treatment for our patients. If the patient is not adherent to the medication, we can have an interview to know the reason why the patient is not adherent. If we can deduce the reason, we can recommend another therapy to her doctor that is more appropriate to the patient so that she could be more compliant. Pharmacists can also provide proper endorsement to healthcare professionals through the use of tools and score sheets by interviewing the patients. This is very important for us to promote interprofessional collaboration within the healthcare team. When you are conducting an interview to your patients, it is very important to use the most comfortable language or dialect that your patient is speaking. One of the recommendations to reduce medication errors and harm is to use the 5 rights: the right patient, the right drug, the right dose, the right route, and the right time. The 5 rights should be taken into consideration when we are conducting our counseling to our patients. This is to avoid medication errors such as wrong dispensing, which is very rampant in the community pharmacy. If the patient is on a tight budget, we can recommend generic alternatives that is fit to her budget to ensure that the patient still receives her medication.
Maraming salamat po sa mga pharmacist ng aming maliit na barangay. Maraming salamat po si Sir Mickey.